to. I would have put it in this presentation, but we wanted to make sure that the link was there. But basically, just flipping to it now. So the reason why they threw the $20,000 number is because what they really should have put was, the $95 flat fee is going to be appropriate for people that are not $9,500 more than the filing threshold. Does that make sense?
Yes.
Okay, so if you were to use real math, you'd add $9,500 to the $97.50, you'd get $19,250. And so they just kind of rounded it for ease of explanation. So if anyone else didn't get that, and you're on the phone or you hear this on YouTube later, send me an email. I'll try to do the math a little better than I'm explaining it here today. Do we have one on the phone?
You have 2 questions remaining.
Being as the advanced premium tax credit is based on income, we need to know what income is. On the long form paper application that was released in February, it shows income as gross wages before taxes. But on the healthcare.gov website, it says that MAGI is essentially the adjusted gross income shown on line 37 of Form 1040. And for most people, there's a huge difference in those 2 numbers. So what is income?
So income is the modified adjusted gross income. That is correct. It is the adjusted gross income line, but it has a few different manipulations. They add back in certain income that wasn't added in before. And I can't quote right now off the top of my head what that is, but what we'll do is Steve added to, we'll define MAGI. Did we already define that? No, we defined lawful presence. Someone wanted lawful presence. There's like a massive 14-paragraph thing we put out there on our Q&A as to what lawful presence is. But we will define MAGI to help you guys out, but it is modified adjusted gross income. I believe they're utilizing or they're copying what MAGI is used for Medicaid to keep it consistent across the board. The paper application is going to be revised to be more closely related to our online application. We were discussing this yesterday and I think this morning. So the latest and greatest paper application that you have seen that's been released is not going to be the final. And so we'll make sure that is delineated appropriately.
Thank you.
In the room, please.
When you were going over about the tax penalty, someone comes to me and says, well, how much is my penalty? It's not our responsibility as agents to calculate that, is it?
No, it's not your responsibility to calculate the tax penalty. I don't know what processes you use to solicit business. If one of those processes is an avoidance process, I'd like to enroll you in health insurance, Damon, because you don't want to pay a tax penalty. We want to make sure that you understand that if they say, well, how much tax penalty am I going to have to pay, that you're not giving them inaccurate information, that you're not saying, well, what did you make last year? I made $25,000. Well, you're going to pay $250 in the tax penalty if you don't sign up for health insurance, which is incorrect. And so the reason why we went over this today is so that you don't, we don't want to trip you guys up in your ability to solicit business. If you know this process and that's one of your decision-making tools that you're going to provide to a client, then you should know how it's done. If you're not going to mention the tax penalty, that's between you and how you're going to sell that business to a customer. But all of our advertising, all of our marketing, we're announcing to everybody that we want you to come and sign up with the exchange. We want you to be a part of this process. The new healthcare mandate requires you to have health insurance, or you will pay a tax penalty. So I expect tax penalty questions to be coming to you. Let's have one on the phone, please.
You have 1 question remaining.
Yes, I've got a question on the shop exchange.
Okay.
Who's going to be paying the claims on that shop exchange? Is there an insurance company, or is it going to be the exchange itself?
So anytime you think of the word exchange or Nevada Health Link, I want you to disassociate that with the term claims. We are not handling claims. We are not processing claims. We will not be dealing with appeals for claims. Claims will be managed solely and specifically by the carrier in which the individual is enrolled in their plan. So if an individual contacts you and says, I have a problem with my claim, please do not direct them to the exchange because we will direct them to their plan.
Okay. Now, what insurance companies do we have that is in the shop exchange so far?
So we're going to have 2. The Anthem and the Nevada Co-op. Those are the 2 carriers that are offering plans on the shop exchange. The shop exchange will have plans offered in all 4 service areas in all counties of Nevada. So we are pleased and excited that we have coverage everywhere. We are waiting a document from the Nevada Division of Insurance. I think they're going to be posting a rate plan, much like they did for the individual rate announcement. If they don't, we'll get something together and bounce it off them and make sure that it meets all the requirements, and then it'll be out. Again, final rates though will not be announced for either market until September 1st, 30 days from open enrollment, which is coming up. Thank you. Anyone else here in the room with a question? Please.
So on the metal tiers, the catastrophic coverage and the out-of-pocket, will that be subject to what the maximums are federally, like $6,350 for a single and $12,700 for a family?
I want to thank you for showing up to all of these, because you asked all the questions that I need to go research, so I appreciate it. You asked me all the ones that aren't like the easy ones. So
thank you.
I don't know that answer, but I will post it, and hopefully, as you guys have seen, any question that we don't know, we find an answer and we put it on the Q&A and then send out an updated Q&A. That I'm not familiar with. Catastrophic plans are probably the least amount of time I've spent doing stuff, so let me find out.
Thank you.
Unless Shane in the back of the room knows. I don't think he does either. So.
Off the top of my head, no.
So we'll find out and we'll get that to you.
Thank you.
Let's try that on the phone.
You have one question remaining.
Go ahead, on the phone.
Hi, this is Julianne in Carson City. My question is regarding the individual carriers. It appears on the website that the 4 carriers only are offering HMO products. Is that accurate? Are we going to have PPO products available, and how is that going to work in the outlying areas where HMOs are very difficult to sell?
So I'll answer all parts of that because there's different answers for each. They are all offering HMOs. There have been no submitted PPO plans for the exchange. That doesn't mean that there won't be any PPO plans off the exchange. We're not at we do not have the knowledge of what's being offered off the exchange. How hard it will be to sell an HMO plan in a rural area. As you've seen from the proposed rates, that there are rating factors for the rurals, and they are higher rates than those within the urban areas. However, please remember back to this presentation, there is a maximum amount that a family or a household is supposed to pay on the individual market for health insurance. And so I'll give you some fictitious numbers here to try to illustrate this point. So if the person who lives here in a rural, or excuse me, in an urban area is supposed to pay $200 a month for their health insurance, and based on their income and family size, and the plans that are offered here cost $185, they will receive no tax credit, and they will be paying $185 for their plan. Take that same person, same income, same family size, put them out in rural Nevada. If the plans that they're offered to them cost $500, they will receive an advanced premium tax credit if they qualify with all the different qualifiers to reduce that down to the $200 that they're supposed to pay. Is that more than what somebody in the urban area may have to pay? Potentially, through my fictitious numbers I just gave you right now. But it doesn't mean that they're going to have to come up with 5 times the amount of or 4 times the amount of funds to pay for the same types of services. I don't know if that answers your question appropriately. If I didn't, can you please rephrase it for me?
It does, and I guess a follow-up to that would be typically HMOs do not have deductibles and co-insurance as a rule. So I guess a follow-up question to that would be, how are these HMO products really going to be HMO products when you look at the metallic plans?
So they have to meet. So metallic plans have to meet an actuarial value. There is no tried and true. You must have a deductible at this dollar amount, and then to do a copay at this dollar amount. And so when all the carriers submitted their plans to the Nevada Division of Insurance, they had to file on specific templates that used an actual value or an actuarial value calculator that determined if they met those requirements. We have not seen those plans. They're being pushed to us this week. I think they may have been pushed to us as early as yesterday, but staff here at the exchange have not had the opportunity. They still need to be uploaded into our system. And so I don't know what those plan benefit packages are going to look like exactly, and we probably won't know until next month. And until then, we're not going to be able to say exactly what one plan or another plan is going to look like until we see how those plans have been sent over to us from the Division of Insurance. What we can say is that those plans all had to be validated by the NAIC through the CERT process. And once they were validated, then they had to go through a plan certification process that met all the rules and regulations of the ACA that we had delegated to the Division of Insurance. And they had to go through a rate review process that they follow all of their rules and regulations and standards, both state law and federal law, to ensure that the rates are appropriate. With all of that in mind, then we get those plans at the end and we post them. So if I would gather to say, I would assume that you're not going to see something that isn't allowed by law, regulation, or the Affordable Care Act posted on our website for people to purchase.
Thank you.
Any other questions in the room? You have the hard one, so we'll skip you. We'll go over you.
Hopefully this is easy. Maybe I missed, in conjunction with the caller's question, maybe I missed part of your response for it. Is as far as accepting in the rural areas, do you have providers in the rural areas that are going to be willing to accept these HMO plans? Typically, that's really hard to do.
So, as part of the plan certification process, there needs to be ensured that there's network adequacy. There needs to be a certain number of essential community providers. There needs to have a certain number of providers so that there is access. Now, I'm not going to lie to you and tell you that access for everybody in the state of Nevada is going to be equal, and access is just going to be amazing. You can call up your doctor and you'll be seen in 15 minutes, because that is definitely not going to happen. However, in order for that plan to be approved, it has to demonstrate that it has those appropriate networks. And so what we have to assume on our end is that once we receive that plan from the Division of Insurance, that it has met the initial network adequacy requirements. And then there will be ongoing network adequacy requirements that we'll have to work with the Division of Insurance to ensure that those plans still maintain those appropriate networks.
Any kind of idea of what kind of percentages of providers they're saying is adequate? I mean, in an area where you have 3 doctors and they say, okay, 1 will take the plan.
So we recognize when we had discussions with the Division of Insurance, and we actually brought this up at some of our board meetings, we actually approved network adequacy standards for the exchange because the Division of Insurance had not received the direct authority from the legislature yet. That was part of their bill this year. And so we worked with them to develop what we felt would be appropriate, and then that was vetted across all the carriers. We also included we included a large group of folks to look at it to see if it was going to be fair. We had a lot of public comment at our board meetings. All of our board meetings, by the way, are posted on our website. You can go to our meetings tab and follow this process along. If you go to under our resources tab where you find the broker onboarding page, you can also find the carrier onboarding page. And down there, about 3/4 of the way down to the bottom, is the network adequacy standards that were approved by our board. So it discusses what are the driving distances and times for access to care that is required to meet the network adequacy requirements for every plan that's going to exist. And they broke it out into urban, rural, and frontier. So all of those are out there. I can't quote them to you off the top of my head right now, but I know that every plan had to meet those requirements or it couldn't meet plan certification. And if you would like, I can send that out to everybody on the listserv. These are the network adequacy standards, or I can, if you email us at brokers and agents at exchange.nv.gov, I will send you that direct link to those 2 documents. That is what we're moving forward with to ensure we have network adequacy in all of the areas across Nevada.
And I guess my concern is because I deal a lot with the Medicare HMOs. And there are HMOs that are available to people in the rural areas that there isn't a single doctor that will take them. And that is supposedly considered adequate.
So remember also that network adequacy, at least for the state of Nevada, originally was performed by the Department of Health and Human Services and had it all the way up until this year. And it was and the rules were only existed for HMOs. And so we here in Nevada, and I don't know about the rest of the nation, but we've had to meet network adequacy requirements that are imposed by the federal government. So we didn't, when I said that we developed network adequacy standards, we didn't just kind of get a group of people together and say, what sounds good? We started with, what is the requirements from the federal government? And then what do we have to do to those requirements, up, down, left, or right, to make them more appropriate for our distinct geographical situation that we have here in Nevada? I think what we've come up with is appropriate. The Division of Insurance thinks it's appropriate. And so I hate to say this to you in this way, but wait and see. Let's see what exists.
How long before we'll be able to see the provider list?
So provider lists have to be submitted with the plans. They are being submitted to the exchange, and they will be a searchable function that individuals and shop employers can once they look at the different plans that they want, they can see what all the different providers are available for those networks. So the answer is once we can show the entire plan. And so again, please remember with the 50-something days that we have, we're trying to make sure that plans actually show up right now on our site, that we flip that switch and people can purchase health insurance, 12:01 a.m. on October 1st. That's not what we're asking, so don't go out and tell everyone, please, October 1st at midnight, go sign up for health insurance, but we need to make sure that the system works. And so we're still receiving plans, we're still receiving provider lists, so I think we'll have more information next month. But we're hoping, if things go well, we'll be able to do some form of public show. I don't think we're going to run out of time. I think October 1 is when you're going to see everything that we're going to see. We're all going to see it at the same time, and we're going to have faith that everything was done appropriately. And if it hasn't, we're going to have to make adjustments. Do I have another question on the phone? Probably the total answer you wanted to hear.
One question remaining.
Yes, on a tax credit, I'm reading your slide, and what if you have a couple, one is employed and the other spouse is not employed? Would they be able to, the non-employed spouse with family, be able to get a tax credit?
So it's a great question, and I realized as I'm reading this, I didn't really explain that to its fullest. So I'm going to take a few minutes to do that so everyone gets the same benefit instead of a yes or no. So I'm going to use myself as an example. I'll pick on me. So myself, my wife, and my 2 children, and we work for Company X. And Company X says to me, you're a full-time employee, we're going to offer you medical insurance. And insurance and is affordable for me, and they're going to pay half of my medical insurance, and so that the part that I'm responsible to pay is less than 9.5% of my income, so it's considered affordable and it meets minimum value. Then they say to me, and we'll also offer medical insurance to your spouse and your 2 kids, but we can't afford to make any contributions, and there's no law requiring us to do so. So your $400 or your $200 a month payment for you just became $600 a month for you and your family. Now, when I look at my income, I see that $600 is more than 9.5% of my income, my household income, and so I believe it's unaffordable to me. But the law reads very specific. The affordability clause only applies to the employee's portion of their insurance premium. So in that example, if my $200 a month is affordable, then my wife and my 2 kids, they can go on the individual exchange, but they will not be receiving a tax credit. They will not be eligible for that tax credit. I know I see all these big eyes in here, and that's how I felt when I first heard about it. Now, if my employer at Company X offers me that $200 a month premium for myself, which is affordable, meets minimum essential coverage, minimum value, and they do not offer coverage to my wife and my 2 kids, my wife and my 2 kids can go onto the individual exchange, purchase a qualified health plan, and they will be eligible for the advanced premium tax credit and cost sharing reductions if my household income allows it. So it still has to meet those requirements for income and household size. So in a nutshell, what does that do to spouses and dependents? Is if the employer cannot afford to make those contributions, especially year 1 when there is no employer penalty, I'm not certain. I'm not saying what employers should do, but they have a decision to make if they're going to offer coverage to spouses and dependents, and they need to incorporate all of these laws, rules, and regulations to determine what's best to retain their talent and to keep those families and to keep them in medical insurance. But that is it in a nutshell, and hopefully that answered your question.
Isn't there a
It does,
statute?
thank you.
Okay, in the room?
Isn't there a statute that says that you have to offer coverage to dependents and spouses?
And there is. You have to offer coverage. If you have, I think it's 50 or more full-time equivalent, you have to offer coverage to dependents, not to spouses. And they separate out spouses from dependents.
No, I'm saying the current
Correct.
Nevada statute.
So
But I
current,
don't think it says 50 employees anymore.
it's supposed to be, I believe, if you are a large group employer, and in Nevada defines a small group employer as 50 or less than 50, so that's why I use the term 50 or more. So you do have to, but then the argument comes in, so what happens if you don't? Well, if you don't, you're supposed to be assessed a penalty. But that penalty is now pushed off to 2015. So an employer that has 50 or more employees will make a decision if they're going to offer to their dependents. Even though it says that they have to, there's no enforceable law that says what happens if they don't. They're supposed to be penalized, but that penalty has been pushed off. But be prepared in 2015 for that penalty to come back. Now they may push it off again. Who knows what's going to happen? Every day here is a whole new experience. But as of right now, as of the time of this presentation, this is the information we have. Let me get one from the phone, and then I'll get back to you.
You have one question remaining.
Hi, this is Ann in Las Vegas. If you have children over the age of 18, can they get insurance on the exchange, or do they have to go with their parents until they're 26?
No, so the rule says if you have a child that is over 18 but under 26, they may remain on their parents' health plan, or they may not. They can go and purchase their own insurance on the individual exchange as an individual adult. To be honest with you, you can have a child that's under 18 that, and we'll use that example, myself, my wife, and my kids, and my employer doesn't offer my children insurance, but they offer me and my wife insurance. And I want to put my children on a child-only plan. And so children can then, they're not actually making the purchase, you're making it for them, but you're signing up your children to go on the individual exchange, and depending on your income and your household size and your federal poverty level will determine if you get any advanced premium tax credit or cost sharing reductions to help pay for those child-only plans. So no, they don't have to remain on a parent's plan, but they can. All right, I'm ready for you.
Well, it's not that hard. I'm going to
For you.
No, I want to piggyback on what Julianne asked, and you may not have the answer for this, but I think you do. So you had said that the individual carriers through the exchange will only be HMO plans. Is that the same on the shop for the Anthem and Nevada Co-op?
Yes.
Would those only be HMO and no PPO?
So everything that we've seen that I've been told to date, all of the plans that the synopsis of what plans are coming over, they're all HMOs for both the shop and for the individual market. I would assume it's because of network limitations and having out of network issues and those types of things, but I don't want to speak for the carriers as to why they only submitted HMOs.
So then the other part to that question is HMOs do not have high deductible health plans or
Correct.
health savings accounts, so
Correct.
those will not be offered through the exchange.
As of right now, unless we get something different, we'll have HMOs, and we'll follow all the HMO rules and regulations of the new marketplace beginning in 2014. That's the company line.
Okay. Okay. All right.
Phone, please.
You have one question remaining.
Hi, I have a question about the dependent coverage again. If you
Okay.
have a child that, say, is 21 and she makes a little too much where you can choose whether or not to claim her as a dependent on your taxes, how does that work with adding her to your health insurance?
So what we will do is when that family enrolls through the single stream application, they will say, we'll say it's a couple with that one child who's 21. And they will say, it's me and my spouse and my 21-year-old child. We will then, and then this is the household income. So you have to add that child's income to the household income to determine the appropriate amount of the advanced premium tax credit, or if they receive it at all. And then we will bounce that information through our eligibility engine to the federal hub, and it'll come back and it'll say, well, yep, their last tax return showed all three of them, or showed two of them, or showed one of them, or whatever it shows. And then we will come back and we will say, okay, well, if there's a discrepancy between what we've received from the federal hub and from what that family has attested to, we will then say, no problem, we're going to believe you, self-attestation, we're going to go through the process of signing you up for a health plan. based off of your tested information, then we will send out a notice to that household saying, we need you to submit supporting documentation for the following. And so they'll need to submit that supporting documentation because it couldn't be verified through the federal system. And there's some thresholds that I think I went over at an earlier session, but we will ask for that supporting documentation. It's called the reasonable opportunity period. I'm not going to go too far into this after that because that's going to be part of our appeals discussion next week. But basically, once we receive that information, we will then render a decision. And that decision will either be, yep, what you tested to, we see that you've proven that this is your situation, move forward, you remain on your plan, everything stays the same. No, you haven't satisfied the requirements of our documentation, and so now we're going to redetermine you based off of what the federal hub said. And then you can go through the appeals process. We'll talk about appeals next week. So here's where it's really going to get you. At the end of the year, that family with that 21-year-old child who has enrolled this person in a qualified health plan, has included that person's income, has maybe advanced premium tax credit determined, maybe they're getting cost sharing reductions, whatever. At the end of the year, that family's going to file taxes. If that family fails to put that 21-year-old on their taxes, there's going to be advanced premium tax credit that may or may not be paid back. And so they'll have to settle that up with the Internal Revenue Service. So remember that we can only take what has been provided to us, and that we can reasonably verify through electronic means, through federal systems, and through documentation that we request from that family to render a decision for advanced premium tax credits. But as I said at the beginning, they're advanced. They're an estimate. They are not the final dollar amount. And an individual who utilizes an advanced premium tax credit is taking sole responsibility for the net effect of that tax credit. Because at the end of the year, the decision will be between that individual and the IRS as to how they settle up. The exchange will have nothing to do with that process, except this is what we paid Damon's family all year long in advanced premium tax credits. Does that answer your question?
Yes, thank you.
Perfect. Any more in the room? Do we have any more on the phone?
You have 0 questions remaining.
So it's a little afternoon with no other questions, and I hope I'm not cutting anyone else off who's quickly trying to hit *6 on the phone. If you have any additional questions, please submit them to the brokers and agents at exchange.nv.gov. We sincerely appreciate this opportunity to work with the broker and agent community to help not only inform and educate, but also understand what some of the issues are. And so we can make plans to solve those issues, if not by October 1, through the next year. And so thank you all for coming. Next week we're going to be going, it's kind of a catch-all. We're doing appeals, we're doing reporting, we're doing reconciliation. And so that presentation I will post here this afternoon, send it out on the listserv so you guys can take a look at it. If you have any questions specifically for that presentation, please send it to our broker and agent at exchange.nv.gov, and we'll try to answer those prior to. Was there any other questions we need to go over?
Nope.
Excellent. Then thank you all for coming. We really appreciate the opportunity for the input. Thank you.
There are 39 participants on the call, including you.